Hi. So, a lot of times in pelvic floor physical therapy, yes, there can be an internal component to our treatment assessment and techniques. And in that case, we would be using maybe some things like this, like the dilators, sometimes the wand, and obviously our anatomy education. Okay, so these are my anal dilators. I like to use them for patients who need more awareness and help with their external anal sphincter. So basically the anus. So they are soft, they have a little give, they've got a rounded tip, right? And then it expands, so you're sliding into the rectal canal, all right? And then many times people will enter into the anal canal, into the rectum, and then leave it there for stretching. Or for more feedback. So sometimes I use it for people who have fecal incontinence, or for people who have anal stenosis, they suffer from fissures or hemorrhoidectomies where it's really, really tight, or they have chronic constipation and they need a little bit more feedback and training on how to relax the anal opening so that they can have effective and pain-free bowel movements. So a lot of times we'll recommend, there's different sizes. So you might start with the little one, okay, and then kind of work your way up to the various sizes. These are my rectal dilators. Again, they're by Intimate Rose, a company made by a pelvic floor physical therapist, and I really love their products. So this is a vaginal pelvic wand. I like to use this for my patients that have trigger points or really point specific pain. I teach them, it can look a little scary. People are always like, I got that squiggly thing off the website. And so this is from, again, a company that I love to work with. They provide really great products for my pelvic patients. It's by Intimate Rose, and I educate patients on where to use this appropriately. So for example, if they're having pain at the bottom of the vagina, especially with intercourse or any sort of penetrative intercourse, you can use the wand and have this guided approach to working in this area. The other thing you can do, let's say they have deeper pain. You're like, oh yeah, when Larry gets really deep in there, I really feel a lot of pain. So I have patients insert it, and it's got this ergonomic kind of handle, and they can work on these muscles that are a little bit deeper and a little bit tighter. And again, a pelvic floor physical therapist would help you, figure out exactly where to use it, exactly how to use it. I even, do hand over hand. I'm like, okay, buy the wand, bring it in. I'm going to put my hand on top of your hand, and I'll help you figure out and how to best find that area so that you can work on it safely and effectively. So you would put it in here like this, and then work on some of those really specific areas. So this is the pelvic wand, and I love using this as well. A lot of times there's a lot of external things that we can use as well. I love using these myofascial decompression cups in the physical therapy world. They're made out of silicone, and what they do is they lift the tissue, okay? And so what it can help with is lifting tissue that might be really tight or adhered to other structures where you need a little more myofascial movement. So this is a great one I use a lot over my C-section scars, episiotomy scars, and they come in different sizes. And I teach patients how to use it. I use it with them, and then I have them purchase it. Other external toys and tools that I use, I like using the roller, sometimes using it, for example, on like really tight structures. So inner thighs can be really tight. I like having, other than, in addition to a stretching program, they can use a roller to help work out some of this myofascial tightness, especially on the inner thigh for patients who have a tight pelvic floor. And then other external tools and tips that I like using is a stretching strap, right? So using a strap to really get the best and the most passive stretch that you can. So these are also really great. So there are a lot of external tools that are in conjunction, and external techniques that we use for pelvic floor PT, in addition to maybe some of the more traditional internal work. And of course, as a manual pelvic floor physical therapist, some work with, just our hands-on techniques.